Welcome to the 7th episode of our video series on cattle farmer training, brought to you by the Karan Beef Academy. This video series will not only give you a good understanding of cattle farming and what needs to be taken into consideration, but will also assist you in becoming more profitable and sustainable as a cattle farmer. We will cover a wide range of topics throughout this series, aimed to inform you on best practice and enlighten you on some new techniques. We will also shed some light on challenges facing cattle farmers and how to overcome them. This episode is about the common syndromes of illnesses that can impact the health of your cattle and herd, and why your animals should be vaccinated annually against notifiable and prevalent diseases. A parasite control program should be applied according to regional requirements and with your veterinarian's recommendations. Furthermore, no vaccination guarantees total prevention, so a very keen eye and time spent with one's animals is important for early syndrome detection. Animals should be vaccinated according to a program relevant to your specific area. Heartwater is a tick-borne disease of cattle, sheep, and some wild ruminants and occurs where the burnt tick is prevalent in warm, humid areas. Heartwater is caused by the microorganism Ehrlichia ruminantium. The disease occurs when a susceptible animal is fed on by an infected tick. Ticks will become infected when they feed on animals whose blood contains the organism. The infected adult female ticks will not spread the disease further until they are fully engorged. They then fall off their hosts and lay their eggs. The eggs hatch to become larvae which feed on intermediate hosts such as rabbits and some ground-dwelling birds. The challenge here is that these hosts cannot be dipped like cattle, so the burnt tick and heartwater cannot be destroyed in areas where these hosts occur. The larvae then fall off the host and become small ticks, which attach to cattle, their final hosts. They feed, grow, transmit diseases, mate, and then gravid females fall off to lay eggs on the ground, thus completing the cycle. Heartwater is not seasonal and occurs all year round. However, the prevalence will vary according to the burnt tick population, which is usually less active in the winter months. Ruminants like cattle, sheep, and goats generally have a natural resistance to the disease in heartwater areas, as they are continuously exposed to infected disease from a very young age. Susceptible animals include animals that are older, have not been exposed to the disease before, and are then moved into a heartwater area, or when animals in a heartwater area lose their immunity after not being regularly exposed to reinfection. Animals will start showing symptoms 9 to 29 days after being infected by the infected tick. Animals will develop a fever, appear listless, foam at the mouth, not eat, and will tend to lag behind the rest of the group. Nervous signs can also be seen as the disease progresses. These nervous symptoms include cattle lifting their front feet high when walking, labored breathing, low hanging heads, and continuous chewing movements. They are also light sensitive and will twitch their eyelids. Some animals will push their heads against solid objects. Infected animals will then lie on their sides, pull their heads right back, and pedal their legs when they are disturbed. Body temperatures will drop below normal during the terminal stages. A diagnosis can be confirmed based on the clinical signs and pathology, but can be difficult to distinguish from other similar diseases. Alternatively, diagnosis can be confirmed through a post-mortem examination and the testing of samples where necessary. Once clinical symptoms have been confirmed, Animals should be treated as soon as possible with any tetracycline antibiotics. Veterinarians can also administer life-saving supportive treatments, which could include intravenous fluid therapy, heart stimulants, and tranquilizers. The biggest reason for mortality is when the tetracycline is administered too late without supportive treatment. In most cases, symptoms are observed after the animal has had a fever for 4 to 6 days, therefore being too late to save the animal with treatment. Should one suspect that an animal is sick, the temperature needs to be taken, and if the animal has a fever, it must be treated. Heartwater can be controlled through the vaccination of young calves, lamb, and goats. Ideally, heartwater can be prevented through competent control of the bond tick numbers that the animal is exposed to, but only as a temporary measure. Animals should still be exposed to some ticks to maintain their natural immunity. The popular method of immunization includes vaccinating and then treating should a fever occur post-vaccination. Animals need to be observed for up to 4 weeks after vaccination for any symptoms and be treated if necessary. Animals must be exposed to infected ticks as soon as possible after vaccination to boost immunity. Pregnant animals should not be vaccinated, but they must be cleared of all ticks. They can be vaccinated after calving. Anaplasmosis, also known as tick-borne gall sickness, is caused by microorganisms called Anaplasma marginale, which is disease-causing, and the less potent Anaplasma centrale. These occur in the red blood cells of infected animals. Once infected, animals will be carriers of the parasite for life, coupled with lifelong immunity. Unlike redwater, there is cross-immunity between the two microorganisms. This means that immunity against Anaplasma centrale will also provide immunity against Anaplasma marginale. Gall sickness is prevalent throughout South Africa, where tick populations are high, usually in high rainfall areas. The disease usually occurs in the same areas as redwater, but can also occur in areas free of redwater. The disease is seasonal, and infections will spike during the warmer months of summer and autumn. Ticks are the most important vectors or carriers of the disease, but it can also be transmitted by biting flies. Of the 5 different species of ticks that transmit the diseases, the one-host blue tick, Rhipicephalus decoloratus, is the most important vector of Anaplasma marginale, and it is the male tick that will spread the disease as he moves from host to host. Animals can also be infected when needles are reused during vaccinations. Calves can be infected in the uterus. They are then carriers of the parasite right from birth. Symptoms will start to present themselves 4 to 6 weeks after being exposed to infected ticks and will include a fever, anemia, jaundice, rumen stasis, and constipation. Cattle that have never been infected or vaccinated are most susceptible to the disease. A vet can make preliminary diagnosis when looking at the clinical signs, but can only confirm a diagnosis when studying a blood smear under a microscope. Targeted treatment with supportive care is advised. Treatments can include antibiotics, intravenous drip, or administering fluids orally if the animal is dehydrated. The animals can also be treated with rumen and appetite stimulants to reactivate the digestive tract. In severe cases, animals might need a blood transfusion. Animals can recover on their own or after treatment, but can also relapse a few weeks after treatment. Prevention and control of anaplasmosis can be through vaccination and tick control, while still maintaining some disease exposure. Babesiosis, more specifically known as redwater, is a tick-borne disease in the cattle industry and can refer to both Asiatic redwater and African redwater. Heartwater is widespread throughout South Africa, apart from low rainfall areas. They most often occur in areas where tick-borne gall sickness occurs. The disease is therefore seasonal and most prevalent when severe tick outbreaks occur during the warmer summer and autumn months. Babesiosis is an infection of the red blood cells by a single-cell parasite of the genus Babesia. This disease is spread between cattle by ticks. The Babesia is injected into the bloodstream by the tick. It then invades the red blood cells and begins dividing, eventually rupturing the cell. Clinical signs begin around 2 weeks after infection. Symptoms and clinical signs include high fever, diarrhea which ceases after around 36 hours and then becomes constipation, red urine due to hemoglobin produced by the rupture of the red blood cells which becomes darker with time, increased pulse rate, loss of appetite, listlessness, weakness, anemia and jaundice in advanced cases, and pregnant cows may abort. Heartwater is diagnosed based on the clinical signs or postmortem lesions. The veterinarian will confirm a diagnosis by looking at a blood or brain smear under a microscope for the presence of the parasites in the red blood cells. Animals should be treated as soon as symptoms appear or a diagnosis is confirmed. If treated during the early stages of the disease, they will most likely recover. Mild cases may recover without treatment. However, vaccination can be used to increase immunity in addition to the animal's natural immunity that is boosted through disease exposure at a young age. Tick control can prevent and control heartwater outbreaks. Older, more susceptible animals can have a vaccine reaction and show symptoms of the disease. The best practice when moving cattle or introducing them to a herd is to minimize the risk of bringing diseases onto the farm. If disease does not enter the herd, it cannot spread within the herd. Identify risk areas, administer preventative treatment to cattle about to be moved to a risk area. Lumpy skin disease, or LSD, is one of the most serious erosion diseases in the beef industry and can affect cattle of all ages. The disease is caused by a Capripox virus that affects all cattle breeds throughout South Africa. But clinical symptoms are more visible in thin-skinned breeds like the dairy breeds. This disease will occur periodically but is most common during wet summer and autumn months and is spread by biting insects and ticks. Lumpy skin disease can be a severe, mild, or inconspicuous viral disease, and clinical symptoms involve a fever, lumps in the skin, and sores in the mucous membranes of the mouth and throat. Animals may show some discharge from the nose, salivation, and lacrimation. The raised lumps in the skin will appear either just before or during the second fever phase. The eyes can then become infected with a secretion or tear production, and the lumps become deep-seated, affecting the skin and subcutaneous tissue. The lumps can also affect the underlying muscle. The number of lumps will vary from a few to a few hundred and may cover the entire animal's body. Bulls can become infertile and pregnant cows can abort when infection is severe. Once the animal recovers, the lumps may heal or become hard and remain visible for several months. With some animals, the hard bumps are cast off, leaving raw, weeping sores and abscesses. Soft and yellow ulcers are also sometimes seen in the mucous membranes of the mouth, nose, air passage, upper stomach, and genital organs. Swelling of the limbs may occur, which is often misdiagnosed as a snake bite. This swelling can then result in lameness or paralysis of the leg. Pneumonia can also occur as a secondary infection. After recovery, stenosis or narrowing of the air passage can develop, making it hard for the animals to breathe. Lumpy skin disease is diagnosed by the typical lesions and clinical symptoms. The diagnosis can be confirmed when cultivating the virus from the skin lesions. Once the diagnosis is confirmed, symptomatic treatment is provided. Antibiotics are given to prevent any secondary infections. To prevent the spread of the disease through the herd, infected animals should be removed from the herd and isolated. Animals older than 6 months should be vaccinated annually, ideally in the spring. Animals develop immunity about 10 days after vaccination and will be fully immunized 3 weeks after vaccination. Lumpy skin disease can also be caused by biting flies and midges, with all the same symptoms, diagnosis and treatments as discussed under ticks. 3-day stiff sickness is an insect-borne viral disease that starts suddenly and has a short duration. The disease is caused by a virus that is transferred from animal to animal through biting insects such as midges and mosquitoes and will negatively affect production and fertility of the infected animals. This sickness is seasonal and occurs mostly in summer and autumn in areas that have good to above average rainfall. The disease will usually disappear after the first frosts. Once an animal has become infected with the disease, it will usually recover with only 2 to 3% of deaths occurring. Once recovered, the animals will be immune to TDS. 3-day stiff sickness can occur in a light, medium, or severe form. The symptoms can therefore vary from light to where the animal will be restless, stiff and has a fever for hours, to where the animal cannot walk but will still have an appetite. In medium cases, the animal has no appetite, does not keep up with the herd, is stiff and develops a lameness that shifts from leg to leg. There are also secretions from the eyes and nose and sometimes swelling around the joints. Infected animals will also have a fever. Symptoms will generally improve 2 to 3 days after the fever has dropped and is back to normal. In severe cases, the animal will lie down with its chest on the ground and be unable to stand. These animals are then at a high risk for pneumonia, bloat, and rumen stasis, where the rumen stops working. They also cannot swallow feed. The animal will then salivate, be constipated, and hold its head to one side. It will then shift position and lie on its side, and there is no longer reflex movement. The animal then goes into a coma and dies. In some cases, cows in late pregnancy will abort. 3-day stiff sickness can be diagnosed based on a veterinarian's preliminary diagnosis by looking at the clinical signs of the sick animals along with the season and other relevant history. Blood samples may be taken from the sick and recovered animals to detect antibodies. Milk fever, botulism, black quarter, neurotoxicosis, physical wounds, and plant poisoning can sometimes be confused with this disease as they have the same clinical symptoms. Treatment involves treating the symptoms rather than the disease. Consult with a veterinarian. Allow the animals to rest and protect them from environmental factors such as heat stress, cold, and wind. Supply clean, fresh water and palatable feed. Should the animal be dehydrated, give it some fluids. Administer anti-inflammatory drugs to treat the inflammation along with the calcium, zinc, and iron if necessary. Do not give any fluids orally if the swallow reflex is not working. Treat the constipation and rumen stasis. 3-day stiff sickness can be prevented through immunization. Not all animals will develop immunity from the vaccine, and a second or booster vaccine is advised in high rainfall areas. Other preventative measures will involve spraying the animals with fly or insect repellent, and the animals should graze in high-lying areas. Younger heifers should be exposed to the virus after their vaccination to develop a stronger immunity. Rift Valley fever is a severe insect-borne viral disease of hoofed animals, which also poses a threat to humans. Animals are initially infected after being bitten by mosquitoes that are carrying the virus. The virus will then further spread through direct contact of animals, aborted fetuses, and other materials. Symptoms in cows can be mild with a mortality rate of 10 to 15%. In adult cattle, sometimes the only symptom is abortion, which can have an occurrence of 10 to 40%. The virus will generally occur in late summer when the humidity is high and temperature is warm with good rainfall. Animals are more susceptible when grazing low-lying areas close to small dams and marshes where mosquitoes are most active. The disease will occur sporadically and can be dormant for years before animals are infected again. A confirmed diagnosis will only occur after a post-mortem examination is done by a veterinarian. The clinical symptoms and history of abortions will also help the veterinarian to confirm the diagnosis. Rift Valley fever needs to be taken into consideration when there is a high incidence of abortions in older animals and mortality in young animals. To prevent self-infection, post-mortems should not be done by the farmer. Rift Valley fever can be prevented through immunization, after which immunity will only develop 2 to 3 months after vaccination. The disease can be further prevented by grazing animals in high-lying areas during high vector periods. Protective clothing should be worn at all times when dealing with abortions or any infected material. Poor body condition affects both cow and calf performance. It is associated with increased calving intervals, weak calves at birth, low quality and quantity of colostrum, reduced milk production, increased dystocia, lower weaning weights, and more susceptibility to disease. Grazing and feed quality is vital to an animal's health and well-being. The type and amount of nutrient demand for cattle will be determined by the seasons, production stage of the animal, and the state of grazing available. The nutritional value of grazing land differs as drastically as the environments in which they are found, and there is no one-size-fits-all approach to correct the nutritional deficiencies or imbalances in the various types of pastures. For this reason, a number of supplementary feeds for ruminants are available from suppliers, like the 3-phase lick program, which has been developed for a cow-calf system in areas where big differences occur in the nutritional value of summer and winter pastures, and where acute to moderate deficiencies in phosphorus occur. Supplementary licks, and more especially those with urea, must be fed with extreme care. If done incorrectly, it can kill your entire herd. So make sure you get a nutritionist's advice or that of a professional from your local cooperative or representative before feeding any supplementary licks to your herd. Cattle are often subjected to eating plastic and other foreign objects while they are grazing. Therefore, it needs to be considered when you plan a camp that the area is properly cleaned and cleared of glass, wire, or metal objects lying around that could possibly injure the cow. Plastic bags and other objects like wire, once ingested, cannot be digested or passed by an animal, so it stays in the gut. Over a period of time, these materials make large tight balls inside the rumen, leading to anorexia, decreased production, and progressive loss of body condition. Endo- and ectoparasites are organisms living in or on and metabolically dependent on another organism. Endoparasites live inside an organism, and ectoparasites live on the surface of the host. Parasites can be carnivorous if living with animals or herbivorous if living with plants. These parasites can be prevented by dipping, using porons, deworming, and medicating, or by injecting endectocides. Endectocides or macrocyclic lactones are veterinary parasiticides used to control nematodes and arthropods affecting livestock. Animals treated with these products fecally excrete residues that are toxic to dung-inhabiting insects, including species that accelerate dung degradation. The cold chain is the most important factor to take into consideration when buying or handling vaccines. Breaking the cold chain is the main reason why vaccinations fail. The vaccine cold chain is a temperature-controlled supply chain and will include all vaccine-related equipment and procedures. The cold chain will start with the cold storage where vaccines are made, extend to the transport, then to where the vaccine is sold, for example, a vet or co-op, then the transfer of the vaccine from the vet or co-op to the farm, the storage on the farm, and finally to its end use, the actual injecting of cattle when vaccinating. To safely inject your cattle, bear in mind that the only acceptable site for injection is the neck as per the figure shown. Especially important to remember is that there is a significant risk of muscle damage when injecting in the rump. Your most valuable meat is in this area. There are certain rules to abide by when vaccinating your animals. If you are reusing syringes or needles, sterilize them by boiling in water for at least 15 minutes. Do not wash with disinfectant or methylated spirits. Use a separate needle per animal wherever possible to avoid the transfer of disease-causing viruses and bacteria. Shake the vaccine bottle each time before filling the syringe. Some vaccines need to be mixed or prepared by mixing the freeze-dried material with water. The vaccines must be administered immediately. Avoid exposing the vaccine to high temperatures or direct sunlight during the vaccination process or during storage. Do not mix two different vaccines in the same syringe. Vaccines must also not be mixed with antibiotics, vitamins, or deworming substances for vaccination and injecting. Do not vaccinate calves before the age of 10 weeks if the mother has already been vaccinated. Be aware that about 1% of the herd have a risk of not developing immunity from the vaccine. Thank you for watching. We do hope you've enjoyed this episode. Please follow our social media channels for more and make sure to subscribe to our YouTube channel to access the other videos in this series. Until next time, goodbye.